COPD includes two main conditions, chronic bronchitis and emphysema. Bronchitis is an inflammation of the bronchial tubes. It causes coughing and may cause the production of sputum. Bronchitis can be acute or chronic. Chronic bronchitis is an inflammation of the bronchial tubes that lasts for many months and comes back at least 2 years in a row. The bronchial tubes stay inflamed, which causes them to swell and produce more mucus. Chronic bronchitis is often a part of chronic obstructive respiratory disorder, but a client may also have chronic bronchitis without COPD. Risk factors for chronic bronchitis include the risk factors for COPD, since chronic bronchitis is a type of COPD. Risk factors a client can control are smoking, breathing secondhand smoke, and exposure to substances that irritate the lungs, like pollution, chemicals, fumes, and dust. Risk factors a client can't control are family history of lung disease, older age, a history of childhood respiratory illness, and gastroesophageal reflux disease, or GERD. The major symptom of chronic bronchitis is a cough with lots of sputum production. Other symptoms include shortness of breath and wheezing, especially with activity. Acute bronchitis is a short-term infection usually caused by a virus. It lasts from 5 days to 3 weeks. It usually goes away without any treatment. Acute bronchitis is caused by the same virus that causes colds and flu, so being near others who have respiratory infections or the flu is a controllable risk factor. Smoking is also a controllable risk factor for acute bronchitis. Uncontrollable risk factors include COPD, asthma, and allergies. Since the virus that causes acute bronchitis is the same as the flu virus, it's important to encourage clients to get their flu vaccine. The most common symptom of acute bronchitis is a cough, often with the production of mucus. Other signs and symptoms are shortness of breath, wheezing, chest tightness, and fever. Emphysema is another main type of COPD and often occurs with chronic bronchitis. Emphysema affects the alveoli, those small air sacs in the lungs. The air sacs lose their abilities to stretch and expand and stop working properly when inhaling and exhaling, so air can get trapped inside. This also means that air carrying oxygen has a harder time getting into the alveoli. Also, the small walls inside the air sacs get destroyed. That means the alveoli become one big air sac instead of many small ones grouped together, a ball instead of a bunch of grapes. With these walls destroyed, there isn't as much space in the alveoli for gas exchange to take place. The risk factors for emphysema are the same as COPD, since emphysema is one of the main types of COPD. Controllable risk factors are smoking, breathing secondhand smoke, and exposure to substances that irritate the lungs, like pollution, chemicals, fumes, and dust. Uncontrollable risk factors are asthma and a rare genetic disorder called alpha-1 antitrypsin deficiency. Early on, your client may not have any signs or symptoms, but as the disease progresses, the most common symptom is dyspnea, also known as shortness of breath. They may first notice this when they're being active. Over time, dyspnea will get worse and might even occur when they're at rest. Since emphysema and chronic bronchitis often occur together, a client with emphysema may also have a cough with sputum production. In addition, they may experience wheezing and chest tightness.